Hello and welcome to 72 Dragons Health. Today we had the pleasure of speaking with Kevin Folivi. Kevin Folivi is a graduate student of the Medical College of Wisconsin, United States. His career goal is to become a physician scientist. During his master's degree at the Medical College of Wisconsin in the Global Health Equity Program, he has had the chance to work with communities all over the world, including on projects in Milwaukee, Nepal, and Uganda, tackling chronic disorders and their underlying factors such as food insecurity. After his master's degree, he will continue his studies at MCW in the PhD program in public and community health. He was born in Togo. His work and experience enabled him to have a closer look at individuals struggling with substance use and diabetes without equitable access to adequate tools and assistance. Therefore, his goal is to transform research into real-world action that benefits the communities he serves. The significance of community support for the overall success of health programs and initiatives is emphasized in the digital narrative, A Community of Wellness, Kinship Community Food Center. It centers on the Kinship Community Food Center in Milwaukee, Wisconsin, whose primary goal is to provide food to the underprivileged in the city. Despite this, Kinship acknowledges that food insecurity is a contributing factor to chronic illness and cannot be handled in a vacuum. As a result, Kinship seeks to support and develop communities while advancing wellness and economic opportunities for all individuals who enter their doors. Moreover, Kevin and his team are presenting their film, A Community of Wellness, Kinship Community Food Center, at the American Public Health Association, APHA, annual meeting on October 28, 2024, as part of the Public Health Film Festival by the American Public Health Association. In the session, Kevin, along with other young filmmakers, will bring important public health concerns to light and encourage dialogue in the light of the importance of social determinant of health and other relevant factors. My name is Dr. Pietro Aparicio from 72 Dragons Health. Welcome to this interview, Kevin Folivi. It is an honor to have you with us today.
Thank you so much for having me.
Kevin, can you please tell us what motivated you to make this film production, A Community of Wellness, Kinship Community Food Center?
Well, I was really inspired by the way Kinship Community Food Center not only addresses food insecurity, but how they foster deep and lasting community connections. This promotes health equity, and through my time volunteering with them, it became clear that their story needed to be shared, and through that, capture the vibrancy and the mutual support within this program. And film was the ideal medium for that. And through that, we're hoped for people to experience the energy and resilience and hope that is fostered here.
Wonderful. Now, your research includes exploring the relationship between the gut-brain axis. Can you expand on how that affects our immune system and also day-to-day activities?
Yeah, sure. So the gut-brain axis is this bidirectional communication pathway between the gastrointestinal tract and the brain. This plays a crucial role in maintaining both physical and mental health. So the gut-associated lymphoid tissue houses significant portions of the body immune cells, and these communicate between the gut and the brain and regulate immune response. So when the gut is unhealthy, this often disrupts serotonin production, which is facilitated inside the gut. And this can lead to mood disorders, anxiety, depression, a lot of things. So ultimately, this affects us on our day-to-day basis, So being able to address that or tackle that or enhance it to boost, how we respond to sickness and also mental health is a very, very interesting and cool way to look at things. And yeah.
Very interesting. You perform a systematic review on the components and effectiveness of self-management interventions among adult type 2 diabetes mellitus patients in low-income countries. Can you tell us what were the key findings from this review?
Yeah, before I start, I'd like to say that, this project was manned by Arthur Kikono, who's a colleague of mine here at MCW. He's a PhD candidate, and it was PI'd by Dr. Dixon Gomez. So always, shout out, credit to them, an amazing opportunity to be part of this project. So what we saw that, there was significant decrease in HbA1c and fasting blood sugar when these intervention incorporated tailored, culturally tailored interventions for the community. This includes, family-supported, community-based self-management education. It also includes aerobic and resistant exercise, self-monitoring programs for blood glucose, and peer-led structured patient education. One thing that we noted in that was that education alone did not reduce, patient blood sugar. It was actually through empowering patients to be able to manage their symptoms at home.
Now, what were the topics that you mainly focused on while doing the group project as part of Sprout Milwaukee? And how does this project help in addressing the polysubstance drug crisis in Milwaukee?
So the Sprouts project is assessing the perception of substance use disorder within faith-based communities, such as, churches, synagogue, temples, and so on. With that, we wanted to look at exactly how substance use was perceived, and then also what resources these communities provides towards people living with substance use disorder among them. The churches and faith-based places are a staple in most communities. They're the foundation to which people go to seek help, and being able to have it as a space where one is open to share goes a long way. And through that project, we hope to not only assess the resources provided towards this, but if there aren't any, or there's not much, we're hoping to connect these faith-based institutions to either other programs doing that or empower them and give them the resources to actually facilitate and address this issue.
Sounds like great work. Now, your film is part of the American Public Health Association's Film Festival 2024. The theme of APHA annual meeting this year is Rebuilding Trust in Public Health and Science. In what ways do you think your film aligns with the APHA's theme?
Well, community buy-in is very important. It's the essence of public health, where by working with Kinship, we weren't just observers, but we were, actively in the community. Before we even started this project, we volunteered with Kinship for a long while, and it was through that volunteering and building relationship that we saw that, hey, this is something that is really working. It's awesome. But the really cool thing about the Kinship process is that it involves the community in, the management of the program, the planning, the everything, all the other aspects. And it kind of highlights how essential it is to engage the community and co-create health initiatives with the community. It's one thing to, as researchers, to go in and be like, hey, you guys diabetes is a high prevalence here, but without actually getting input from the community about how we can best, tackle this issue and develop culturally appropriate responses that, doesn't really work well. So, rebuilding trust means, incorporating the community within every process of the way, and together we can actually do something,
Sounds great. Kevin Folivi, thank you for sharing your insights and your research projects. Thank you for bringing forward the inspirational work that the Kinship Community Food Center is doing to build and strengthen the community in Milwaukee, Wisconsin, through your film, A Community of Wellness, Kinship Community Food Center. We wish you all the successes for your film and your coming endeavors. Thank you.
Thank you. Thank you so much.